Hi everyone, welcome back to my YouTube channel and today we are going to talk about Tourette syndrome. So let's start our topic with introduction. Tourette syndrome is a neurological disorder that is characterized by repetitive involuntary movements and vocalization that are called tics. It is a chronic condition that begins in childhood, often around the age of 5 to 10. Although severity of tics varies, Tourette syndrome can affect social interaction, academic performance, and self-esteem. Tourette syndrome is more common in males than females and can co-occur with other neurodevelopmental or psychiatric conditions. Definition of Tourette syndrome. Tourette syndrome is defined as neurodevelopmental disorder that is characterized by multiple motor tics and at least one vocal tic that persists for more than 1 year, with onset before 18. Tics are sudden, rapid, recurrent, non-rhythmic movements or sounds that are usually involuntary but may be temporarily suppressed. Epidemiology of Tourette syndrome. It is approximately 0.3 to 1% of children worldwide. It affects male to female ratio is it affects more 3 males as compared to 1 female. So ratio is 3:1. Its symptoms typically begins in early childhood and peak in severity during pre-adolescence. Many individuals experience a decrease in tic severity during late adolescence or child adulthood. Causes and etiology of Tourette syndrome. Exact cause of Tourette syndrome is unknown, but it is believed to result from genetic and neurobiological factors. Genetic factors, it is related strongly heredity link, as children with a family history of Tourette syndrome are at higher risk. Multiple genes may contribute, but no single gene is responsible to this. Then there is neurochemical and brain factors, as abnormalities in dopamine, serotonin, and norepinephrine pathways in the brain can cause Tourette syndrome. Dysfunction in the basal ganglia, frontal cortex, and corticostriatal thalamocortical circuits, which are involved in movement control and behavior regulation, can also cause Tourette syndrome. Then there are environmental factors like premature birth or low birth weight, and complications during pregnancy and infections or immune response may predispose to Tourette syndrome. Types of Tourette syndrome. First is motor tics, that is simple motor tics that include quick, sudden movements such as blinking, shoulder shrugging, or head jerking. Second is complex motor tic, that is coordinated patterns like touching objects, jumping, or bending. Second type of Tourette syndrome is vocal tics that are also called as phonic tics. They may be simple vocal tics that include grunting, sniffing, coughing, or throat clearing, and complex vocal tics that is include repeating words or phrases, sometimes inappropriate words. Signs and symptoms of Tourette syndrome. Tics vary in frequency and intensity and may change over time. Common features include sudden repetitive movements or sounds, worsening of tics during stress or excitement. There is temporary suppression of tics, it is possible but may lead to discomfort. Co-occurring conditions such as ADHD, OCD, anxiety, or learning difficulties is there. There is fatigue or sleep disturbances due to frequent tics. Diagnosis of Tourette syndrome. Diagnosis is based on clinical observation and history, as there is no laboratory test for Tourette syndrome. First, we will talk about diagnostic criteria, that is, multiple motor tics and at least one vocal tics are present for more than 1 year. Onset should be before age 18. Symptoms are not caused by medication or another medical condition. And then we do is differential diagnosis with other conditions that are similar symptoms, such as chronic motor or vocal disorder, stereotypic movement disorder, and seizure disorder or other neurological conditions. Treatment of Tourette syndrome. Treatment depends on severity of the tics and their impacts on daily life. Many individuals have mild tics that do not require treatment. They include behavioral therapy that is comprehensive behavioral intervention for tics that teaches patients to recognize and control tics. And this habit reversal training and relaxation techniques are done during behavioral therapy. We can also do medications for Tourette syndrome that is used for moderate to severe tics or when co-occurring disorder exists. We can use dopamine blockers like risperidone or haloperidol. We can use alpha 2 agonists like clonidine and guanfacine. We we can do other medications like ADHD that are used for ADHD or OCD symptoms. Then we can do supportive measures for Tourette syndromes that include education and counseling for patients and families, school accommodation for children, stress management and sleep hygiene. We can also do experimental or advanced therapies that include deep brain stimulation in rare, severe treatment resistant cases. Complications of Tourette syndrome. While Tourette syndrome itself is not life threatening, complications may include social stigma and bullying, anxiety or depression, poor academic or occupational performances, sleep problems, impact on self esteem and quality of life. Prognosis of Tourette syndrome. Many children see a reduction in tic severity in late adolescence or adulthood. Prognosis is generally favorable for long term functioning, especially with supportive therapy and education. Early diagnosis and management improve social and academic outcomes. Conclusion of this lecture video. Tourette syndrome is a neurodevelopmental disorder that is characterized by motor and vocal tics that begins in childhood. Although it can be socially and emotionally challenging, most individuals lead productive lives with proper behavioral interventions, supportive care, and with necessary medication. Awareness, understanding, and early intervention are essential for minimizing the impact of disorder and improving overall quality of life. And this was all about Tourette syndrome. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.